Thank you so much for all of the great questions that people are posing about colonoscopy, how to plan for it, what's the best test to have, what to do next. And I want to answer some of those questions in this video. To start, we have a couple of questions about prep, and the first is whether coconut water is a good clear liquid. And I would say that the coconut waters that I've seen are often a little bit cloudy. And so no, this would not be an ideal clear liquid. But if the coconut water is clear, is that really coconut water that you want to drink? And so in either circumstance, I would say it's either not a good clear liquid or it's probably not good coconut water. Our next viewer wants to know why they're having loose stools even before starting the prep. The clear liquid diet itself can cause you to have some loose stools because you're probably drinking some things that have a lot of sweetener, whether that's high fructose corn syrup, it's stevia, it's sucralose. All of these are not well absorbed, and that is going to provoke diarrhea. When you don't have a lot of fiber around to bind things up, that will also make your stools looser. And another staple of a clear liquid diet is gelatin products, and that gelatin is also not very well absorbed, and so it's going to cause diarrhea. Now, these are things that you want to avoid if you have IBS diarrhea, but if you're prepping for a colonoscopy, it's like pre-gaming. So go ahead and have all the clear liquids that you want with sucralose, stevia, and high fructose corn syrup, but skip them all the other days of the year. Our next viewer wants to know, why not just have a flexible sigmoidoscopy? Well, come on now, that'd almost be like going out for a date and after appetizers saying you don't want to have an entree. Just would leave me sad. But really, a sigmoidoscopy is only covering the left side of your colon. This would be like having a favorite band and you've never listened to the B-sides. There's some sleeper hits there, and you don't want to miss some of the sleeper polyps that reside on the right side of the colon. In fact, some of the flatter polyps that we think cause cancers, they reside on the right side of the colon. It's not as if cancer ignores the right side of the colon, so we shouldn't either. We need to look for polyps on the far side of the colon, and that's only achieved when you do a colonoscopy. And so it's clear that there's an advantage to looking at the whole colon. To follow that question up, another one about alternatives to a colonoscopy, this one asking when can you have a stool test after a colonoscopy? And whether you can have a stool test depends on what the findings of the colonoscopy were. If you have a family history of colon cancer, then you should really always proceed with having a colonoscopy because you are considered at high risk. And if you yourself prove to have polyps on an initial colonoscopy, then you also are someone who is at high risk. But if after an initial colonoscopy you have totally no findings, then one consideration is, should you just proceed forward with a non-invasive test? And I think that there is a place for doing this for people that wish to try to minimize invasive testing. It's perfectly fair. But the question is, when should you start that? We don't really have a good answer to this, but I think the best advice is to consider that that first colonoscopy is a warranty, if you will, warranty for the next 10 years. And at that interval, when you would otherwise be recommended to have another colonoscopy, perhaps you consider a non-invasive testing going forward. I think it remains that a colonoscopy is the best preventative procedure to ward off colon cancer. However, it's also clear that no test is the worst test, and so I'd much rather you continue forward by having a stool test than to do nothing at all. To conclude this series of questions, someone asked, what about taking probiotics after colonoscopy? Now, I think there's a little bit of a misconception that when you've had your colon cleansed to prep for the colonoscopy, that it's somehow now void of bacteria. In fact, there are probably still billions, if not trillions, of bacteria still lining your colon. And over the intervening days, as food starts to continue back down the chute, they're going to eat the leftovers and it will reconstitute your normal gut flora. Studies, in fact, have even shown this, that about 2 weeks following a colonoscopy, people will have a normal gut flora again. Definitely have a well-deserved splurge meal after your colonoscopy, but I think it is important to eat healthy food thereafter. Food that is rich in fiber from fruit and vegetable sources is going to do the best to help reconstitute a healthy flora of bacteria, and you don't necessarily need probiotics. Some fermented foods or cultured foods, these can be helpful, but having large amounts of those will actually cause a lot of people to have some IBS symptoms. So I don't think that you need to go crazy with it. Basically, just go back to eating like you did before, but hopefully this is an opportunity to really make sure that you're eating as healthy as possible. So probiotics are ultimately not necessary and something that I won't have after I have my colonoscopy. I hope you found the answers to these common questions about colonoscopy helpful to prepare for your own colonoscopy and to understand what to do next after you finish yours. Thank you for watching and be safe.